I'm Carol Celine, talking with cardiologist Dr. Paul Mather. You were brought here to Jefferson to head the heart failure and heart transplant program, and you have about 3,000 patients in your care, but only 180 of them or so are actually candidates for transplant. So what can you do for all the others?
10 years ago, if you had asked me that same question, I would have said about 25 to 30% of the people referred to me for advanced heart failure would end up receiving a transplant. Currently, I think the statistic is around 7%. So for the other 93%, we find something else to do. Actually, it's more likely the other 90%. 3% came too late and there was nothing that could be done. But in the other 90%, we fine-tune their medicines, improve their diet and exercise, and hopefully impact on their quality of life. And sometimes we even use mechanical devices such as pacemakers that resynchronize the heart to help them make the performance of their heart more efficient.
You have mechanical devices, little tiny battery-sized things that you can implant right into the heart that do more than adjust the timing and the firing. They actually help the heart pump.
Even within the last 5 years, we've gone from 4-pound titanium hearts that are implanted above the stomach of the patient to hearts that are the size of C batteries and even smaller. And so the technology has taken leaps and bounds, and as the technology has become more efficient and implantable, more patients become eligible for these devices. And what these devices do is actually take over the pumping of the heart.
Well, this would be such a miracle because I think the numbers of people nationwide that need heart transplants are something like 14,000, and just a little percentage of them will actually get donor hearts. But with these devices, they could live for what, years?
Absolutely. Every year, as you said, 14,000 Americans become eligible for heart transplant, but we only end up doing 2,000 to 3,000 depending on the year. In fact, last year there were only 1,900 heart transplants done. So for the other 12,000, survival becomes a key. So as people develop end-stage heart failure, I think the future is in these devices as they become miniaturized.
Now, in terms of donors, the Gift of Life donor program is well known. Is it important that people remember to just check that little box on their license? Is that how most donors become known to doctors?
Well, that's the first step, but also please tell your immediate family members because they can convey that message when you can't.
So we mentioned earlier you were head of the heart failure and heart transplant program. Could you tell us a little bit about what that program is?
Okay, what that program is a multidisciplinary approach to the multidisciplinary patient. The patient is not heart disease. The patient is a person who has heart disease that affects every part of their body, both physically, mentally, and not just their bodies, but their caregivers, their families, their friends, and their society. So what we try and do is approach the patient from a holistic point of view, where we deal with everything from the medical management, surgical management, nutrition, exercise, psychology, financial support, all those things that make us who we are and can impact on our quality of life.
I love that, because a patient is always more than their disease.
Absolutely.
Thanks for coming in.
Thank you very much.